Most hockey players think that they have weak hips, but the real problem isn't strength, it's control. A lot of players feel unstable through their hips, their knees, and their lower back. And it's not because they're weak, it's because they're missing one key function, which is rotational control over a fixed skate. A muscle that accomplishes this task and that should be worked properly is known as our gluteus medius. And there is a piece that most traditional hip exercises never touch. The gluteus medius isn't just one muscle, it's actually split between two different areas. The back belly of the muscle group controls abduction and external rotation. The front fibers of the gluteus medius control internal rotation, and this is the missing piece that most practitioners don't target. We need these front fibers for skate stride, edge control, and most importantly, directional changing. Why this matters in hockey is because if we have a weak anterior belly of the gluteus medius, our pelvis can't rotate over our stance leg, being the leg that's planted on the ice. This is how you target the front portion of the gluteus medius muscle. For a warm-up, you're going to get a band and you're going to place it on the top portion of your ankles. Lie face down over a foam roller. The foam roller is going to be placed on our lower ribs. Knees slightly bent, having our heels facing the ceiling. Gently turn your toes towards one another. Heels should then turn slightly away. Keep the knees very still. Repetitively do this movement for 10 repetitions. What you should feel is the glute getting activated. You should not feel the side of our hip getting activated because that's a separate muscle group known as our TFL muscle. Do about 10 repetitions of one set. Let's progress to the exercise. You're gonna have the exact same setup, but you're gonna change the leg movement. Now you can incorporate separating your legs from one another as you're keeping your toes facing one another and the heels away. This will further engage your gluteus medius muscle. Do that for about 10 repetitions of 2 sets. This will then engage even more fibers of your anterior gluteus medius.